We will see thyroid storm, its clinical features, and the rationale of using propranolol, that is a non-selective beta blockers, and the summary of management of thyroid storm. So thyroid storm, it is a very rare condition. It is very less encountered, but it is a medical emergency with a very high mortality rate. Thyroid storm is less encountered, but a fatal medical emergency. Thyroid storm is due to the hyposecretion of thyroid hormones. It will be seen in those individuals which will have thyroid levels unmanaged. So, individuals with unmanaged thyroid levels are predisposed to thyroid storm, like Graves' disease and toxic nodular goiter, which are example of hypothyroidism. These can lead to thyroid storm. So, conditions like Graves' disease and toxic nodular goiter can lead to thyroid storm. The symptoms are pyrexia, tachycardia, altered sensorium, increased sympathetic activation. It can even lead to death because of organ failure if it is left untreated. So, the symptoms of thyroid storm are pyrexia, that is high body temperature, tachycardia, high heart rate, altered sensorium, and increased sympathetic activation. It can even lead to death because of organ failure. So, in thyroid storm, we use beta adrenergic blockers, especially the non selective beta blockers like propranolol. These non selective beta blockers, they have a very important role in management of thyrotoxic crisis. See, in thyroid storm, there will be hypersecretion of thyroxine. Thyroxine stimulates heart and causes high heart rate and cardiac output. So, in thyroid storm, the symptoms are high heart rate and high cardiac output. In this case, we administer beta blockers like propranolol. These beta blockers will block the beta 1 receptors present on the heart. In the SA node and AV node, beta 1 blockers are present. These beta blockers will block these beta 1 receptors present on SA node and AV node. This will lead to a decrease in the heart rate. The most commonly used beta blocker is propranolol. See, first of all, it will act on the heart, it will decrease heart rate, it will decrease the cardiac output. It also has a additional effect that it will prevent the conversion of T4 to T3, and this will help in relieving the symptoms of thyroid storm. So propranolol, it does, first of all, it will act on the heart and decrease heart rate, decrease cardiac output. It also prevents the conversion of T4 to T3, and this will help in relieving the symptoms of thyroid storm. What are the symptoms of thyroid storm? Increased heart rate and consequent high blood pressure. थायराइड स्टॉर्म में इंक्रीज्ड हार्ट रेट होता है, इंक्रीज्ड ब्लड प्रेशर होता है, एंड प्रोपेनोलॉल डिक्रीजेस दीज सिम्टम्स. So beta blockers like propranolol, this will antagonize the effect of thyroid hormone not only on heart but peripherally on the circulated on the circulatory system as well. Okay, it will act both on heart and it will also act on the periphery by inhibiting the conversion of T4 to T3. So in thyroid storm we use beta blockers, but they are not the only option available. We require immediate medical attention. So, symptomatic treatment of thyroid storm. To treat hyperadrenergic symptoms, we have propranolol. Propranolol will have combined beta blockade and antithyroid effect. If beta blocker is contraindicated in that patient, we can consider calcium channel blockers like diltiazem. ठीक है, तो hyperadrenergic symptoms के लिए we have propranolol. If propranolol is contraindicated, use calcium channel blockers like diltiazem. Then hypothermia is a symptom. तो हाई बॉडी टेम्परेचर को लो करने के लिए वी विल यूज़ एक्सटर्नल कूलिंग टेक्निक्स सच एज आइस पैक्स, cooling blankets, and alcohol washers. We can use antipyretics like acetaminophen but avoid aspirin in thyroid storm. ठीक है, हाइपोथर्मिया को कंट्रोल करने के लिए एक्सटर्नल कूलिंग टेक्निक्स लाइक cooling blankets, alcohol washes, ice packs. We can use antipyretics, example acetaminophen, but avoid aspirin. Then to treat hypotension and hypovolemia, fluid resuscitation is done to treat the insensible and GI losses. फ्लूइड लॉस होता है, देयर इज़ हाइपोवोलीमिया, तो इसको ट्रीट करने के लिए वी गिव फ्लूइड resuscitation. Electrolyte disturbances are managed accordingly. Agitation को मैनेज करने के लिए benzodiazepines are given, example lorazepam. Concurrent conditions को ट्रीट करने के लिए like CHF, that is congestive heart failure and atrial fibrillation. Then anti-thyroid drugs. पहले वो ड्रग्स जो कि थायराइड के सिंथेसिस को इनहिबिट करेंगे, दीज आर प्रोपाइल थायोयूरासिल. द ऑल्टरनेटिव टू प्रोपाइल थायरोयूरासिल इज मेथिमाजोल. Then the inhibition of thyroid hormone release. First line are iodine solutions which are given at least 1 hour after the antithyroid drugs like potassium iodide solution and Lugol solution. These iodide solution they will inhibit the release of thyroid hormone. और अगर पेशेंट में आयोडीन का एलर्जी है या आयोडीन इंड्यूस्ड थायराइड टॉक्सिकोसिस के केस में lithium is used to inhibit the release. Then for inhibition of the peripheral conversion of T4 to T3, propranolol and glucocorticoids. Glucocorticoids can also treat the recurrent adrenal insufficiency. सो थायराइड स्टॉर्म में सिम्टोमेटिक ट्रीटमेंट को मैनेज करता है हाइपर एड्रेनर्जिक ट्रीटमेंट. हाइपर एड्रेनर्जिक सिम्टम्स को मैनेज करने के लिए प्रोपेनोलॉल एंड अगर प्रोपेनोलॉल कॉन्ट्राइंडिकेटेड है तो कैल्शियम चैनल ब्लॉकर्स लाइक डिल्टियाजाम. हाइपोथर्मिया को मैनेज करने के लिए एक्सटर्नल कूलिंग टेक्निक्स लाइक अल्कोहल वॉशेस, कूलिंग ब्लैंकेट्स, आइस पैक्स, एंटीपायरेटिक्स लाइक एसिटामिनोफेन बट अवॉइड एस्पिरिन. Then we manage hypotension and hypovolemia by doing fluid resuscitation. This is done to treat the insensible and GI losses. Then electrolyte disturbances are managed accordingly. Agitations को manage करने के लिए benzodiazepine like lorazepam is given. Then anti-thyroid drugs में पहला है जो कि thyroid synthesis ना होने देते like propyl thiouracil. Alternative is methimazole. फिर थायराइड रिलीज को इनहिबिट करने के लिए फर्स्ट लाइन में आयोडीन सोल्यूशंस लाइक लूगोल्स सोल्यूशन, पोटेशियम आयोडाइड सोल्यूशन. और अगर आयोडीन एलर्जी है या आयोडीन इंड्यूस्ड थायरोटॉक्सिकोसिस है तो लिथियम कैन बी यूज्ड. और प्रोपेनोलॉल और ग्लूकोकॉर्टिकॉइड को यूज़ करते हैं टू इनहिबिट द पेरिफेरल कन्वर्शन ऑफ T4 to T3.